have a doctor in the house. Dr. Riley Williams III is an orthopedic surgeon and sports medicine surgeon at the Hospital for Special Surgery, and he is also the medical director and team doctor for our local team, the Brooklyn Nets. Welcome to the show.
Thanks for having me.
Great. Glad you can join us. So I just wanted to kind of ask you about your role with the Brooklyn Nets. What are some of your responsibilities as a team doctor and a medical director?
Well, obviously, my primary goal and directive as a medical director is for the health and well-being of our players, and that involves obviously managing injuries, getting them back to play, but also other things that people don't necessarily think of: preventative strategies, health, nutrition, mental sort of health issues that are in and around the stresses of being a professional basketball player. And then once you get past the team, there are the management, there are the executives. I mean, you really are managing the entire entity with regard to health and well-being issues, so it's quite involved.
Right. Normally when we think of doctors and surgeons, we think of what happens after an injury occurs. They come see you. But you did mention some of the preventative measures. What are some of the preventative measures that the athletes take in order to
that's a
be
good
healthy?
question. Well, I think it'd be a good time to talk about the recent opening of the HSS Brooklyn Nets training facility, which is right here in Brooklyn. It's a state-of-the-art training facility, and this is where the bulk of the team's operations exist. They practice there. So I'll give you an example. During a typical home stand, say they have a game tonight, they would all arrive at that training facility this morning at around 10 o'clock. They'll get there, they'll relax, they'll interact with the training staff, which includes all our athletic trainers, physical therapists, nutritionist, strength and conditioning coach, do a review based on where they are in the season, stresses, little nagging injuries that maybe they have. And it's very quick, but this happens on a daily basis. And then they practice. So at the beginning of the season, you'll talk about, okay, what were your issues last year? How can we prevent those things this year? And it's a really coordinated approach from all facets of the medical team in order to sort of help them get through this long season. It starts well into September and lasts through April.
What are some of the challenges that you face in your role in terms of preventative and I guess also just managing what happens when the athletes are sidelined? And I can imagine that they're competitive, and so it must be hard for them to sit on the sidelines and recuperate. And do you find there's some kind of struggles between doctor and patient in that way?
I'd say that happens rarely. I think most of the time that's really a big thing that's on me. So just to give you a little bit of a description, our medical team consists of myself. There are a couple of other orthopedic surgeons who are involved, but I also have a couple of medical practitioners, specifically internal medicine and cardiology, who also are an integral part of the staff and team. And quite honestly, most of the issues on a day-to-day basis are medical. Oh, I have a cold. Stomach upset. I'm throwing up. Things that happen that just happen to normal people, but are very germane and important with regards to maybe them taking the court tonight or moving forward. So really my job is to sort of keep all the chess pieces moving, help the team to come together, make sure the communication is straight between management, ownership, and everything else. But you mentioned one thing which I think is important to remember, and I think people, the casual fan, will forget. I mean, these guys are under a lot of pressure. Yes, they're well remunerated, and I don't begrudge them anything, but they're seldom home. Their sleeping habits are funny. Like, there's a rule in the NBA that when you have a game tomorrow, you have to be in that city today. So if there's a game today, you can't leave until tonight. So you're leaving to fly, for example, to Miami tonight at 11. You arrive in Miami at 2. You get to your room at 3. You go to bed at 3:15 in the morning, and you have to get up for shoot around at 10.
Oh, wow.
And now you're playing another game at 7:30.
Right.
So it's and that happens repetitively. So we're looking at things now that maybe, say, a couple of decades we never looked at, like sleep habits, rest. What are the guys doing in their off hours? We can't control them, but we certainly can help them strategize and make better decisions.
Right. You talked about the athletes come to you if they have something like a cold, and with the recent development with Maria Sharapova and her failing a drug test based on something a doctor prescribed to her, as a doctor, is that something, an added responsibility for you? Like, if you were to prescribe something to someone, do you go through and make sure it's not on the banned substance list, or is that something that the patient?
The NBA has a very clear and explicit policy on banned substances, to which there's really no response. If you take it, you're banned. So it's our job as the doctors to know what they are, and we do. We review those on an annualized basis, and when there are changes to the list, we know what they are. So myself and my colleagues have been at this well over a decade. This is my 12th year with the team, so I know what the list is.
Yeah.
So while I'm not going to comment on her situation
Sure.
specifically, I can tell you with no uncertainty that we know what we're doing and do our very well best in a good way to keep our players out of harm's way.
Excellent. So I guess, what made you decide to be a doctor, and specifically go into sports medicine, orthopedic surgery?
So I grew up in Los Angeles, just south of what's affectionately known as Compton, but right in that area. Not a great area. I had an affinity for the sciences, and listen, just to be very honest, I had to get out of there. So fortunately, I had a bit of an aptitude for my schoolwork. It wasn't really hard for me, and I figured, okay, so what are the professions what professions make money, right? What professions make money? And so there was business, which I didn't really understand what business meant. It seemed a little iffy and unpredictable. Lawyers made money, and I, in my very primitive way, equilibrated being a lawyer with arguing, so I didn't really want to do that. But medicine, I was like, okay, medicine, doctor, okay, that's good. They're respected. They make some money. I can do that. And what I really liked about it was that it was a path. Do well in college, do well in medical school, do well in a residency, you'll get a job. So it wasn't like I was going to be dependent upon somebody else and their goodwill or shepherding me in some way to kind of achieve my ultimate goal. So I kind of settled on that. And that was the beginning of it. I played sports in high school and in college. We didn't really settle on sports medicine, quite frankly, till later on in medical school, as I kind of started to understand what doctors really did on a day-to-day basis.
Right. Well, that's excellent. Little personal side note that when I went to college, I was pre-med, and I was going to follow that track, and I hit that wall called organic chemistry, and I said, well, I don't know, maybe this is not for me. So do you have any advice for anybody that might be watching who may be on the path to med school or know somebody who's thinking about a career in medicine?
I actually do. It's pretty straightforward advice, and I get questions from young people all the time. You know, how do I get to do what you do? And so the reality is this, and your example is a great example. Don't kill the dream, right? So stay in the moment and understand that regardless of what you choose to do, doing well will facilitate that. And if you, for example, in your case, if it's really medicine you want to do, I know from my experience and my viewing others, organic chemistry is a big block for not just you, a lot of people, right? And I will tell you under no uncertain terms that organic chemistry has nothing to do with my day-to-day, what I do day-to-day.
Right.
It's just a hurdle. So maybe you don't take organic chemistry with all your other classes. Maybe you take out a loan and take a class during the summer. I mean, I'm not saying it's perfect. I'm just saying don't let the dream die based on a grade that really doesn't bear any resemblance to what you ultimately need to do. You just got to get through it.
Right.
And that's level after level after level. And you really have to have a very long range view about it. Listen, I'm very fortunate. Things worked out very great for me. And I understand there's a certain level of luck and goodwill from other people who you have to come across to get there. But at the same token, what you want to be able to say is when someone is going to advocate for you or talk to someone for you to maybe get a spot or a job, you want them to have a good body of work with which to work, right? So that they can advocate well on your behalf.
Great. In addition to your position with the Brooklyn Nets, you have a position with the Red Bulls, and I believe you're also in private practice.
Yes. How
do you juggle all of this? And I would like to think that you have a life. So how do you juggle all of this?
I'm sure I have some form of attention deficit disorder. I probably manage it better than most, but my days don't seem busy. They're full, but I can't imagine like sitting at a desk and with papers and a computer. That's just not my style. So I'll give you a little insight into my day, and I'll tell you how I juggle it.
Okay.
So let's pick a game day. Nets are playing tonight, for example. So I have 2 teenage girls who don't live at home, so that helps. So they're largely taking care of themselves. So that's one thing, although we're in touch. I'm up at 5:30. I'm at the gym at 6. I'm done at the gym at 7. I'm at the hospital at 7:20. Surgery starts at 8. I do 8 or 9 surgeries. I'm done by 4:30. I'm in my office making calls. I'm in my car making calls. Now I'm at Barclays. It's 6:30. I check on the players. I eat something. Now I'm sitting at the game. The game starts at 7:40. It's done at 9:45. I'm in my car. I'm calling some more people. I get home. It's 10:30.
I'm tired just hearing that. Wow.
Talk to my wife, and I typically go to bed at midnight, and I'm up at 5:15. 5 hours.
You didn't mention breakfast, lunch, dinner. Oh, you just said dinner.
I don't eat much. I don't eat much. That's part of the secret. So.
Is that sound advice from a doctor? Not eating much during the day?
That's me. That's just me. You just gotta do what's right for you.
Well, maybe that's how you keep your figure. Maybe I need to, you said 500 calories per day.
That's
reportedly
a little low.
maybe.
A little low. That's a little low. That's not. I'm not an internist. I'm an orthopedic surgeon.
Excellent. Mike, do you have?
I do. One of the things I have been looking at your Twitter feed, and some good news came out of New York City this past weekend with your alma mater, Yale, making the NCAA tournament. Certainly some excitement there. This is the first time in a long time that they're getting to the big dance. How excited are you, and what do you think it means for the school to get back there?
I'm a big believer in school spirit and sports. Unfortunately, when I was there, it just wasn't really a big priority, and I lived with, quite frankly, all my roommates were basketball players, so I've always had a bit of an affinity for Yale basketball, and now that I'm with the Nets, there's just a natural symbiosis and interest there. They almost made it last year and had some unfortunate losses at the end of the season, which prevented it, but it's been 54 years
That's right.
since they've been to the tournament, so listen, I love my school. I thought it was tough while I was there, but it's just good to see them have some good fortune. I'm good friends with the athletic director and coach, Dean there. So it's just a nice source of pride for all the alumni. A lot of the Yale alumni is here in the area, and contrary to belief, yes, it's Ivy League, but it's good basketball. It's good basketball. I got some good guys in there, and I just want to remind you that Jeremy Lin did go to Harvard. He's still in the NBA, and you just never know what kind of talents are going to go through those schools. So I'm super excited.
Then as far as the Nets, we were able to see at the press conference a couple of weeks ago up in Sunset Park for the Nets coming over here to Brooklyn, really solidifying that by making the transition where they're going to be practicing here in Brooklyn from now on as opposed to out in New Jersey. It's been a down season for them, but really over the last few weeks, it seems like things are kind of turning around for a little bit. They're 4-5 since the All-Star break. They're playing a little bit better. Certainly some losing could continue through the rest of the way, but they now have a new general manager in Sean Marks. They've solidified this move. Do you feel like there's a different level of positivity than there was as far as maybe a month or 5 weeks ago before some of these changes have happened?
Well, I think having been with the team a long time, I've seen some peaks and valleys, and all I can really say about it is it's nice to have some clarity with regards to leadership. And I think the experience that Sean Marks will bring us from the Spurs with regards to the type of culture they're able to perpetuate there. And I don't know if you saw today, they just hired Trajan Langdon, who's a Duke guy, as the assistant GM. That to me, my brother went to Duke, by the way, so I'm a big Duke fan. So,
yay! So did I.
All right, very good. So so the answer is yes. And listen, I root for the Nets. I follow Nets daily and kind of keep abreast of how people are feeling about it. And the thing for me is, if you really look at Brooklyn and just the type of identity that is Brooklyn, it's a gritty, hard-working, lunch pail type community that's like, I describe it as true. It's just without pretense, real, kind of in your face a little bit. And all you have to do, from my opinion, and it's just my personal opinion, is have a team that is kind of built in the same fashion, right? Cares about the community, comes out, gives an effort, and I think that's what you're seeing. Like, you're right. They may not win every time, but it's fun when they're in the game. It's interesting, and what I've seen over the past 3 seasons The first year we were there and the Miami Heat came to town, it was 3/4 Miami Heat fans because they could get seats relatively cheaply. Now you see like real people really interested, and it's very gratifying, at least for I'm not even part of management, right? I'm just there because you want the team to do well. It just provides a good feeling in and around the organization. And you're right, now that they're here in Brooklyn, it's really, I think good things are coming.
In terms of the move to Brooklyn, have you noticed a difference in the players and being able to say that they have a home in Brooklyn, or do they still kind of have this conflict between whether or not they keep their lives in New Jersey that was established when the Nets were there, and now being in Brooklyn?
Well, I think we're still in a transition period. We just made the move. It was a mid-season move. I think the only Net that truly moved over was Thaddeus Young, who has a family and really decided he was going to make a home here. I think it remains to be seen. Obviously, just from a convenience standpoint, you'd love to be here. Getting from Brooklyn to New Jersey, even just across the river, can be a little difficult in terms of how you get there. But clearly, there wasn't a whole lot going on in Jersey, and it was, honestly, I was there for those years. It was the difficult transition because everyone knew they were coming over here, but yet they were still trying to sell tickets to New Jersey. It was just tough. So this I just think, in terms of the entirety of the enterprise, rounds out the story. And I think what you'll see is that the vast majority of the players will probably be in the Brooklyn confines directly, or maybe Southern Manhattan. But clearly it'll be much more New York based, undoubtedly, just from a convenience standpoint.
Yeah, and I'm hoping that they will be, by them being in Brooklyn or in surrounding areas, that there will be more of a connection between the fans and the team, because it kind of feels like before they were kind of out there and not really part of Brooklyn. So hopefully that'll foster a nice relationship and drive fans to the stadium.
Well, let's be honest. I mean, the New York Knicks have been New York team for many decades, and if you're a tried and true New Yorker fan of basketball, that's who you followed. And I don't think those loyalties are broken easily. However, how cool is having the Barclays Center with this great new shiny toy sitting right in the middle of it? I think I'd say, hey, I know you root for the Knicks. There's no reason why you can't root for the Nets too when they're not playing each other.
Sure.
And I think that is something that'll be organic and happen over time as the team remains here and continues to do well.
Yeah. And there's a lot of Brooklyn pride. So I mean, I'm a recent transplant from New Jersey, and I love it. So I'm excited that the Brooklyn Nets are here, and looking forward just to see how they continue to grow and become more one with the community.
It's happening. It's definitely happening.
And that food at the Barclays, I'll tell you,
Yeah.
I am a little bit of a foodie, and that's one of the things I enjoy most about going to the Nets game is going to the Barclays. It's really nice, pristine. The people are friendly, but that food choice is something other than just your standard hot dogs and hamburgers, which are great, but I love variety. And that macaroni and cheese is great.
I'm not a mac and cheese guy. I'm going to go on the record. But listen, I agree with you 1,000%. It's a wonderful place to go. That schedule I laid out to you was unembellished. It is what it is. But, by the time I get to Barclays at the end of the day, it's not, you're at a basketball game. So I'm working. But,
Yeah.
But it's certainly not stressful, and it's really a wonderful, it's a diamond. I think as more people sort of get over there and discover it, it'll become even more popular.
Great. Well, I'd like to thank you so very much for joining us. It was wonderful talking to you.
You too. Another
Thank
Dookie.
That's
You
right.
guys are everywhere.